Hi, my name is Anna, and I'm here to speak to you about fevers in children and why not always to be afraid of them. When you become a parent, a whole new world of fears and anxieties are unlocked. And at some point in time, your child is going to contract an illness of some sort, whether it's a cold, an ear infection, something, a virus, etc., that will cause them to develop a fever. It's pretty inevitable. Um, Fever is something that can be really scary to see in your child, but you don't always have to be fearful of it. As a mother of four and a registered nurse, I've had many experiences with fever in children, and I too have experienced fear around my children having a fever. And after doing my own research and what I have learned in the medical field, I feel more empowered and reassured that most of the time, fever is harmless and actually beneficial in helping fight off infections. As the American Academy of Pediatrics states, fever is a natural response of the body's immune system when the body detects an infection or other illness. A fever is considered anything that is 100.4 or above, with the normal body temperature being around 98.6 degrees in most people. In Meyer's work, Evidence-Based Education to Improve Caregiver Knowledge of Fever Management in Young Children, she says childhood fever is a common symptom seen in healthcare and a significant source of caregiver anxiety that leads to non-urgent visits and unnecessary medication use. Most fever episodes in children can be managed at home, but lack of knowledge causes fever phobia and contributes to improper management. If your child develops any symptoms of a fever or new illness, please reach out to your child's pediatrician for more guidance. Fever usually can be managed at home with over-the-counter medications such as Tylenol or Motrin. In Meyer's work, she mentions that reducing a fever is not always required, though, and should really only be treated when causing discomfort or distress, such as pain. That being said, there are certain things to look out for that indicate that you should seek medical attention for your child. The American Academy of Pediatrics has some recommendations about when to seek medical attention. These include if fever repeatedly goes up to 104 or above, if they develop a seizure, if they have a history of immune system problems, of course, if they're younger than 12 weeks old, so those little itty babies, or if there's other symptoms that are more severe, like a stiff neck or severe headache, any kind of severe pain, an unexplained rash, or repeated vomiting or diarrhea. They also mention if overheated, if that's the cause of the fever, they should definitely be seen, such as if they are left in a hot car or were exposed to a high degree of heat for any reason, or just generally looks very ill, then, having them seen is very important. But otherwise, if your child is generally doing okay, still having moments of being interactive and playful and drinking fluids, it's okay to let their body do its own thing to fight off the infection. There are some things you can do at home to help keep your child more comfortable. One of them, the most important things, is to keep them well hydrated by giving plenty of fluids. Some signs of dehydration, as stated by the American Academy of Pediatrics, include crying with no tears, a very dry mouth, and fewer wet diapers if they're still in diapers, or decreased urine output if they're older. Letting them rest is also very important, as this will give them the strength their bodies need to fight off an infection. Dressing in one layer of clothing and not over bundling is also important. And then it's also really important to have medication on hand, such as Tylenol or Motrin, and also a reliable thermometer is a good tool to have on hand with children. So a fever of 102 degrees or less is considered a low-grade fever and can be monitored instead of treated. If your child is comfortable and not complaining of any pain or is overly fussy, a fever of 102 and under can be treated without the use of medication. And it's important to keep in mind that most fevers are short in duration and have protective mechanisms, and there is no evidence that fever puts children at an increased risk of adverse effects. In conclusion, fevers in children are not always something to be fearful of and can be beneficial.